Bloating on GLP-1 medicines. What causes it and how to help? Are you taking a GLP-1 medicine like semaglutide or liraglutide and struggling with bloating? You're not alone, and there are practical things you can do about it. Bloating is one of the most commonly reported side effects of GLP-1 receptor agonists, including medicines like Ozempic, Wegovy, Trulicity, and Saxenda. If you're on one of these treatments for type 2 diabetes or weight management, understanding why it happens can make it a lot easier to deal with. So why does bloating occur? These medicines work by mimicking a natural gut hormone called GLP-1. One of the ways they're effective is by slowing down gastric emptying, meaning food moves more slowly from your stomach into your small intestine. This is what helps you feel fuller for longer. But that same mechanism means food and gas stay in your digestive tract for longer too, which is what causes that uncomfortable, distended feeling. The good news is that for many people, bloating tends to improve as your body adjusts to the medicine. And there are evidence-based strategies that can help in the meantime, starting with what you eat. Prioritizing easily digestible foods makes a real difference. Think lean proteins, cooked vegetables, and low FODMAP options like carrots, courgettes, and spinach. On the other hand, it's worth avoiding high-fat meals, cruciferous vegetables like broccoli and cabbage, legumes, artificial sweeteners like sorbitol, and carbonated drinks, all of which can make bloating worse. Smaller, more frequent meals are generally easier on your digestive system than large ones. One important note here, if you use insulin or a sulfonylurea, speak to your diabetes team before changing your meal patterns and keep an eye out for signs of low blood sugar. How you eat matters too. Eating slowly and chewing thoroughly gives your digestive system a better chance to keep up. Staying well hydrated with still water, rather than sparkling, also helps support gut motility. When it comes to lifestyle, gentle physical activity after meals like a short walk can encourage things to move along more comfortably. Managing stress is also worth considering, as it can have a real impact on gut function. If dietary and lifestyle changes aren't giving you enough relief, it's worth having a conversation with your doctor or pharmacist. They may be able to discuss adjusting your dose titration schedule, since slower dose increases can sometimes reduce side effects. They might also talk you through whether an over-the-counter remedy like simethicone could be appropriate for you, or whether a different GLP-1 formulation might suit you better. Always take any medicine as directed by your prescriber and never adjust your dose without speaking to them first. Now, there are some symptoms that mean you should contact a healthcare professional promptly rather than waiting to see if things settle. These include severe or persistent abdominal pain, vomiting, signs of dehydration, blood in your stools, or anything that feels more serious than typical bloating. These could indicate something that needs proper medical assessment, including conditions like pancreatitis or gallbladder disease, which have been associated with this class of medicine. If you're ever in doubt, please do seek medical advice or contact NHS 111. To recap, bloating on GLP-1 medicines is common and is directly linked to how these medicines work. Dietary changes, smaller meals, easily digestible foods, avoiding known triggers can make a meaningful difference. And if symptoms are persistent or severe, speak to your doctor, as there are medical options worth exploring. If this has been helpful, leave a comment below, especially if you found something that's worked for you. Don't forget to like this video and subscribe to the Bolt Pharmacy channel for more straightforward, medically informed health content. And remember, nothing in this video is a substitute for personal medical advice. Always speak to your healthcare professional about what's right for you.